Hi, I'm Nurse Jessie, Jessica Tonia, and welcome to FAQ by Nurse Jessie. Let's separate medical fact from fiction. Today we're walking through trigger-based action plans for 3 common chronic conditions: asthma, heart failure, and diabetes. Before we dive in, a quick safety note you need to hear right now. Safety disclaimer. This episode explains conservative action plan examples and gives scripts to request clinician-approved plans. Do not change prescription medications or insulin doses unless a clinician has authorized those specific adjustments in writing. If you feel suddenly worse, have trouble breathing, chest pain, fainting, or confusion, seek emergency care immediately. Okay, with that out of the way, here's a short microcase that shows why plans matter. Microcase. A patient with heart failure noticed 3 days of 5-pound weight gain and slightly worse breathlessness. They followed the clinician-approved action plan, called their clinic using the one-line script we'll cover later, and were advised to take an extra pre-authorized diuretic dose that same day. They avoided an ER visit and were scheduled for a quick outpatient check the next morning. That's a win for planning and safety. What is an action plan? In plain language, it's a written, step-by-step set of instructions that tie what you feel or measure at home to clear actions. Trigger plus measurement plans reduce ambiguity. They say, for example, if peak flow is under X or you're more short of breath than usual, do Y. The goal is repeatability. Anyone reading it, you, a caregiver, or a clinician, knows exactly what to do next. Why trigger-based? Because words like worse or as needed mean very different things to different people. Measurements anchor decisions. Peak flow numbers for asthma, daily weight for heart failure, and finger stick glucose for diabetes. But measurements alone aren't perfect. Pair them with symptoms and conservative thresholds, and you get safer, smarter plans. Asthma modules start with common symptom cues: increased cough at night, waking with wheeze, needing rescue inhaler more than twice a week, or difficulty speaking full sentences. If you use a peak flow meter, know your personal best. Green zone is 80 to 100% of your best. Continue daily controller medicine. Yellow zone is 50 to 79%. Use rescue inhaler per your inhaler plan. Add prescribed short course actions, and contact your clinician if you don't improve in 24 to 48 hours. Red is under 50. A few practical reminders for asthma. Confirm with your clinician whether your rescue steps include repeated inhaler doses or a short steroid course. Do not start steroid tablets or higher controller doses unless it's specifically written in your plan. And if you rely on a spacer or nebulizer, keep those devices cleaned and accessible. Heart failure module. The most useful home measurement is daily weight, done at the same time each morning after emptying the bladder and before dressing. A simple, conservative rule that many clinicians accept is if you gain 2 to 3 pounds in a day or 5 pounds in a week, that's a red flag. Also watch increased swelling, new or worsening shortness of breath at rest, or needing to sleep propped up with more pillows. Important medication note before we talk about diuretics. Do not adjust prescription diuretics on your own. If your clinician has already written a specific, signed protocol that says, for example, if weight increases by X, take 1 extra 20 milligram tablet for up to Y days and call the clinic by Z hours, then follow that. If you haven't been given that exact authorization, call your clinician. I'm repeating this warning because changing diuretics without authorization can cause dizziness, low blood pressure, or electrolyte problems. So, what would a conservative heart failure plan line look like? One-line example to bring to your clinician. Please write a weight-based diuretic plan. If morning weight increases by 3+ pounds in 24 hours or 5+ pounds in 7 days, take 1 extra dose of my furosemide 20 milligrams once and call clinic within 12 hours. Replace numbers and drug names with what your clinician approves. That phrasing makes it easy for clinicians to respond and for you to follow safely. Diabetes module, start with recognition. Hypoglycemia signs include sweating, shakiness, confusion, racing heart, or inability to concentrate. Hyperglycemia signs can include excessive thirst, frequent urination, blurred vision, or sometimes nausea. For people using oral medications or non-intensive insulin regimens, conservative carb correction rules might be, if glucose is under 70 milligrams per deciliter, treat with 15 grams of fast-acting carbohydrate. Wait 15 minutes, recheck, and repeat once if needed. For glucose consistently over 250 milligrams per deciliter with ketones, seek clinician advice or emergency care. Very important. Do not change long-acting or mealtime insulin doses unless your clinician has given a specific written titration plan. If you want an insulin adjustment protocol, here's a one-line script to ask for at your visit. Could you write a detailed insulin titration algorithm for me, including when to increase or decrease mealtime insulin and how to handle illness or missed doses? Please include limits so I don't change doses without documentation. This helps you get a clinician-approved plan rather than improvising from internet advice. Now, a 30 to 45-second anonymized patient clip. I'm paraphrasing to protect privacy. A patient said, "I used to wait until I felt awful, coughing at night, terrified, then ended up in the ER. My nurse taught me to use a peak flow meter and a written plan. When my flow hit yellow, I used my rescue inhaler and called the clinic using their script. 2 days later, I avoided going to the ER. It felt like having a map. That's the power of a plan. It takes away guesswork."
Personalizing plans. Kids, pregnancy, people using insulin pumps, or those with multiple conditions often need exceptions. Always note clinician exceptions clearly on the page. For example, for pregnancy, contact OB before any medication change, and include device-specific instructions like target pump correction factors. If you or a family member have comorbidities, ask the clinician to initial or sign the plan so it's clear what modifications apply.
Red flags across conditions. Conservative thresholds that should trigger urgent or emergency care. Sudden severe shortness of breath, chest pain, fainting or near fainting, sudden confusion, or very high glucose with vomiting or altered mental status. If you see any of those, don't try home measures first. Get emergency help. Sharing and documenting where to store plans. Keep a printed copy on the fridge, a photo in your phone's medical folder, and upload a PDF to your patient portal if possible. To request a clinician-approved plan in clinic, use a short, polite script. "I'd like a written action plan for my condition. Can you write specific triggers and actions I can follow at home and add it to my portal?" That simple ask makes it much more likely you'll leave with what you need. 3 concrete takeaways you can do tonight. 1. Print one of the episode templates from the show notes or save it to your phone. 2. Bring this printed template and the one-line script to your next appointment and ask your clinician to fill in specific numbers and sign it. 3. Share the finalized plan with at least one caregiver and upload it to your patient portal so it's available across transitions of care.
Before I sign off, remember, do not self-adjust prescription medications or insulin unless your clinician has provided a written, specific protocol authorizing those exact changes. Use conservative thresholds, pair measurements with symptoms, and when in doubt, call the clinic. You'll find vetted sources and downloadable templates, AHA, ADA, GINA, CDC, linked in the episode notes and in our clinic portal.
If this episode helped you, please subscribe to FAQ by Nurse Jessie so you don't miss future practical guides. Download the templates in the episode notes, bring them to your next visit, and send any questions through the show contact. I read them and I'll use them to shape future episodes. Until next time, stay informed, stay compassionate, and always put safety first.